to actually create a detoxification better than any kidney function. And this is in the area of heavy metals. And, they were using sweat example, and it was shocking, just shocking. And it just reinforced, I floated out of the meeting knowing what we're doing is right.
Wow.
Yeah.
Man, I wish I'd been there. That sounds like
yeah. Well, I don't worry. I have the slide references, so that's coming up. And then probably set up a meeting in Chattanooga next week after, so maybe you can join that there.
Oh, absolutely. I'll be around.
Yes.
Mr.
So
Secret,
everybody,
you are now
I think we're getting everybody on board here. It looks very good. And
Mr. Secret, you are now live. Just so you know.
Who was that?
You are now live in Facebook as well.
Okay, very good. Thank you, Ali. I deeply appreciate you. So everybody, let's get this party started, as they say. So a lot of you were so enamored with the team that was presented on the Scientific Advisory Board at a launch meeting in October. And then we had an interesting experience at the A4M Anti-Aging Conference in Las Vegas, which was an international conference of clinicians, physicians, naturopaths, DOs, MDs, and our booth was so busy, it won the best of show, and it was our first time in the history of the A4M. So first time any organization has gone into the A4M conference with a booth and actually had that accolade provided to them. If you were anywhere near the booth, it was literally till the lights went out at night that people stopped their Avicen introduction. And it was nice because we had 15 minutes to talk with these clinicians and share some of the credibility, but really amazing. So what I wanted to do today was introduce some of the folks that were not at that launch conference, and then certainly leave some time on the conference for Dr. Bird. And then in the future, what I want to have this conference call be, and it'll be on the second Saturday of every month, is to invite your clinicians to talk with clinicians. And that's not only a compliance issue, because I'm not a doctor, so I can't talk about disease states, but you have doctors who have experience with disease states and they can speak to that. And our Scientific Advisory Board, before I get this started with some of the first introductions, the goal of it was to make a diverse population, which means not male-female, but we have male-female, but diversity in clinical experience. And it includes, PhDs, that includes psychiatry, that includes hormonal medicine, that includes chiropractic. We have a chiropractor who actually has a medical degree, things like that, to create the diversity so that we have a number of different eyes looking at what we're doing. And then, again, before we start, just 20 seconds, had a wonderful conversation with the inventor of Avicen, Tom Muehlbauer, just last week, and inviting him to participate not only in the Scientific Advisory Board, but to, he's the warrior. He is the one that has already done the FDA clearance, the science behind the product, and really bringing this out. And he is all in and has enormous connections with, local and San Diego scientific boards and review committees. And this is an amazing opportunity. The reason, the caliber of the people that are aligning with us, because you might wonder, geez, Bill, are you like the magic man, the unbelievable salesperson? No, not at all. We have 14 patents and clinical science that is proven, peer-reviewed science. So that attracts credible clinicians to this product, which is unusual for any product that's out there. So with that, I was wondering if Dr. Michael Pelsman could be unmuted and share some of his information. He was with a patient, and if not, then Dr. Stan Kanota, Harvard-trained individual, and people are thinking, an ophthalmologist? Really? I mean, here's medical director of an organization for 20 years. So Dr. and Stanislaus, for those of you that are not friends with him, and if you quickly become a friend with him, it's Dr. Stan. Stan, welcome to the call.
Thank you very much. Thank you very much, Bill. I really appreciate. I'm so happy and grateful to be in such an organization that has not only has a powerful members, but also will have a powerful impact not only here where we live, but throughout the world. As we know that Nulife Ventures is planning to expand to other nations. So, but on the clinical side, so basically, when I got introduced to the machine, I had an experience that was, I would say, within 30 minutes. I was able to see that this is a very useful tool because I had shared in San Diego that I tried machine late at night around 10 in the evening. At that time, I had worked all day. I was really tired. But after using the machine for 30 minutes, I feel like I was morning again. And I said, wow. So I started reading a little bit about the science behind it and the technology behind it. I knew that from understanding science from the molecular structure, how the body works, how biology works, I knew that this heat therapy that allows for improved microcirculation and the little bit of increase in body temperature that happens during the treatment, all this impacts the immune system. And so when we say that you have improved delivery of oxygen to the tissue, you have improved delivery of nutrients to the tissue, at the same time you're removing toxins. Those are the fundamental key points that allows the body to heal. So I'm just so happy and grateful every day to be part of this community. Thank you very much, Bill. But I'm willing to talk more, but I'm sure you have some guidance in what to say. As I was looking at what to say for new, I've been working with people in my community here in Los Angeles. So people say, what do I say? What does this machine do? I say, well, you're going to get a user guide. So when you're a new representative, you're going to get a user guide. And the best thing, on the very first page, it tells you the indications, what this machine is approved for, what this machine has been approved to be effective at. So you just read those indications. You let a person try the machine. You talk to them heart to heart. It's so beautiful. I'm so happy to be here. Thank you, Bill.
Oh, Dr. Kanota, awesome. And, for those of you that are hearing his voice for the first time, this is an individual that's Harvard trained, a graduate of Harvard Medical School. And however, gets to a very large population for his clinical expertise and chooses to join a community-based organization that was having him as medical director, well qualified, and participated in that community development and really, a warrior for human health. And that is the character of individuals that are on the scientific advisory board. So Stan, awesome to hear your voice. And then another individual that we have that I was recently introduced to through another individual, Dr. Pelsman, and his name is Richard Carlton. And we had a conversation that was so stimulating for only about 30 minutes when I first met him. And I was literally sweating after his conversation because of the excitement. And I don't do that very often. But Dr. Richard Carlton, if you could share some of your observations, and deeply welcome you to the call. Might be on mute.
Dr. Carlton, you need to unmute yourself. It's on the lower left of your screen. Just
there you go. Thank you, Duke.
Okay.
My technical support.
Got it. Thank you. Okay. Michael?
We can hear you now.
Okay. So my colleague, Dr. Michael Pelsman, was talking to me about a patient that we share in common. And then at the end of the conversation about the patient, he says, "You want to tell me about this Avicen device? And if I'm not interested, it's perfectly okay." But he thought I might like to hear about it. So he told me about it. What he told me was that his very severe neurological disease called Guillain-Barré syndrome, which had paralyzed him, is slowly coming out of paralysis. It was leaving him with residual pain, very severe, 8 out of 10, which is excruciating pain. He's a very brave man. As soon as Michael Ladd, one of the distributors, got Michael Peltzman set up with an Avicen machine, the pain went down to 4. That caught my attention. I prescribe medical cannabis for people. I'm pretty, as a psychiatrist, I'm pretty good at helping people with pain, but I've never seen anything like this. So I looked into it and wanted to become a distributor. And I had the great pleasure of having a video conference with Dr. Joey Bird and some other people here. And I told them what I was thinking is going on. I'm going to share with you what I was thinking was going on. Then I'm going to tell you what happened to Joe Bird. So first, here's what I think is going on. You know that you're warming the palm with this machine and that the palm has a special circulation, so there's no capillaries between the artery and the vein. It's a direct shunt in anastomosis. That can really warm up the blood. When you warm the blood, hemoglobin that's in the red blood cells will give up its oxygen much more readily to the tissues. There's something called a hemoglobin oxygen dissociation curve, and it's shaped from where you're sitting like an S curve, sigmoid, and the whole curve gets shifted to the right under heat. That's important for muscles because when the blood is going through the muscles and the muscles are warming up, you want more oxygen delivered, right? So hemoglobin is well designed to cough up its oxygen when it's warm and to keep it more avid when it's cold, like going through the lungs, and you want to absorb the oxygen into the blood and then cough it up in the muscles when they're warmed up. So this device, by raising the temperature of the blood circulating through the body, is going to release much more oxygen. That in itself, if it did nothing else other than that, would be a phenomenal achievement. But it's doing something else, because I know from research that I did on wound healing, I'm pretty well steeped in wound healing. When you tug on the skin with a vacuum, you pull on the connective tissue underlying the skin, which irritates the fibroblasts. These are little cells throughout your connective tissue. And the fibroblasts, in response to this little irritation of being torqued or tweaked, will release growth factors like, I'm sorry to give you some technical names, but vascular endothelial growth factor, VEGF, VEGF. And the VEGF will cause the lining of the blood vessels, the endothelial lining, to make nitric oxide. Nitric oxide will dilate the vessels and do a whole lot of other things that are really important for the body. So, if the warmth and the nitric oxide are propagating through the body, if you're dilating the vessels, and that's why blood pressure comes down, by the way, because you're decreasing resistance. You know, the Nulife data showing mean arterial pressure decreases with the Avicen treatment because you're dilating the vessels, so there's less resistance. So if you're dilating vessels because of the nitric oxide, so there's more blood flowing to the tissues, and then hemoglobin in the blood is delivering up more oxygen, you get a big burst, big load of oxygen being delivered to the tissues. And that's going to heal and cure a lot of medical conditions. Bill and Stan, I'm particularly interested, and Joey, I really want to see how this is going to work in diabetic neuropathy, where the neurons are ischemic, they don't have enough blood. So it's going to be wonderful to see that. And Tom told me that it does work for that, so it's going to be really fun to see. So in that conversation that I was having with some of the heads of Nulife Ventures, it lasted about an hour and a half on a Zoom conference like this. And at the end of the hour and a half, Joey says, "Hey, Richard, I'm experiencing some of the growth factors that you're talking about. I said, what do you mean you're experiencing growth factors? He says he feels really well. So I'm looking at him on the screen, and he's beatific. His face is glowing. Stan, kind of like what you were experiencing. And I said to him, maybe it's an endocannabinoid. Maybe somehow this is stimulating your body's own cannabinoid neurotransmitters. He said, could be. But the look that you feel, the feel that you feel, sitting in front of a fireplace with friends, and you're sipping on hot chocolate, or maybe some grog, and everything's cozy, what the Germans call Gemütlichkeit, that feeling, that's what was on Joey's face. Right, Joey? So I said, there's something really profound going on here. Because if autistic children are getting better, and migraineurs are getting better, things are being released, growth factors, neurotrophic factors. The Parkinson patients are getting better, neurotrophic factors. So what's being released that could make Joey look so contented and happy and calm? I thought about it. Could be the endocannabinoids, but I really began to think it was oxytocin. Oxytocin is really important. It's the bonding hormone. When the mother delivers a baby, a lot of oxytocin is released. It actually helps the propulsion for delivery. When she's suckling the baby, the mom gets a surge of oxytocin, the baby gets a surge of oxytocin, and there's bonding. When you pet your dog or your cat, you get a surge of oxytocin and your pet gets a surge of oxytocin. It's bonding. So Joey was seeming to exhibit, I hate to sound so clinical, a lot of oxytocin, blessed, good feelings. But oxytocin is not just a feel-good hormone. It's actually a very powerful analgesic. And there are journal articles you can find online. I'll be glad to send to anyone who wants to see it. Published by pain specialists, pain clinics, where they're trying to get their patients off of opiates, or at least to avoid opiates in the first place. And they administer oxytocin. And these physicians are reporting that oxytocin is almost as good a pain reliever as the opiates. Isn't that phenomenal? So I looked into oxytocin. Turns out that oxytocin gets secreted, synthesized, and stored in the pituitary. What releases oxytocin when it's stored? Warmth. Avicin does that. And nitric oxide. Avicin does that. So all of a sudden, I'm going, whoa. This is a gold mine, copper mine, diamond mine, silver mine. This device has such a plethora, such an embarrassment of riches for the growth factors and hormones that promote healing and well-being. This is wonderful. I'm so excited to be part of this group. And I just want to close my remarks by saying that a friend of mine who's a therapist quotes a Buddhist expression for something like this. The Buddhists would call this I'm thinking of the term, a righteous livelihood.
For human health.
Yes, and to heal.
Carlton, thank you so much for your contribution.
Thank you.
That's amazing. And so we have to alter your resume for your experience as a miner, which is the gold and the silver. And we will do that immediately. But for those on the call, Dr. Carlton has such a robust background, and he was actually the tipping point that brought the Scientific Advisory Board over 300, which is a number that's really irrelevant to most people. It actually brought the number to 320, and that is the years of clinical experience with direct patient relationships that the Scientific Advisory Board has to speak to their new experience with Avicin. And Dr. Carlton was so exciting to talk to because he was so in depth. And it's interesting that psychiatrists, you would think they're only involved with the head, and what we're doing and emotions and things like that. And his approach is to clinically look at the individual and figure out without medications. But if medications are to be applied, he can do that professionally as well. But to really crawl into the psyche of an individual and look at what's going on in their life and, peel that onion in a way that very few clinicians can do, because it's a caring heart that does that. And, it's not sitting down on a chair and talking for 20 minutes and, oh, you're going to get this medication and off you go, and I'll see you in 30 days when I check the levels. I mean, that's not Dr. Carlton. And then to have his experience delivered to him from our next speaker, who has gone through his own amazing challenges, is a whole other story. It actually brings out great emotion in my voice. So with that, if we could unmute Dr. Pelsman, I would appreciate that.
Dr. Pelsman, could you unmute yourself? I think it's on the lower left there. You should see a microphone. If you can unclick the lower left of your screen, you'll see a microphone with a red slash through it. If you can just click on that, that'll unmute you.
Let's see. These Zoom meetings new to people.
Yeah.
Is it there?
Well,
Michael, you have to move the cursor around. And move the cursor around so you see the bottom of the screen. It's invisible until you move your cursor.
I saw him earlier. Can you get there?
Hey, Bill, while we're waiting,
There you go. Thank you, Dr. Bird.
while we're waiting for him,
Our glowing professional.
yeah, let me tell you, I was actually receiving a treatment when I was talking with Richard, and he started walking through all the growth factors, and it really kind of spurred me to think about what I was experiencing. And so Richard has just a amazing background, and Michael, the story that he has, we're going to have to work it out and figure out how to get him effectively on Zoom, because this is a rich story that will inspire anybody who hears it. I know you heard his story as well. It's quite remarkable. The story of healing and recovery and going from essentially a vibrant, healthy body down to almost complete paralysis, and then recovering that over time.
Yeah, it's amazing. And then Dr. Bird, I'll have you speak in a second if he is not able to come on board. But I did hear the story, and it took 45 minutes to just listen to it, with him occasionally interrupting me. Is this okay to talk about? And am I boring you? And you're right. I was not only not bored, I was so appreciative of the health I have, and then a recognition of the fact that health can become wildly fragile to anybody. And with him, it did. And the emotional part of the conversation was the fact that he literally was to die. And he was in a quadriplegic situation with his body, and his desire was really the ability to read and the ability to just look at something and absorb it. And that's what kept him going. And it's, the most inspirational human study that I ever had as an individual, that a single individual in his own study developed. And then that led to an introduction of Avicen, and then I invited him to the launch meeting and realized that this man is just now to the point going from almost a coma state to his ability to utilize a walker and get on an airplane. And that's the drama of the clinical process that he had, and unbelievable. And then the conviction of, look, this is how this works. This is what it has done for me. And then now him sharing it with other individuals was wildly impressive. And
Bill, I'm going to just reach out to Dr. Pelsman here. I don't mean to interrupt you, but
no
Dr. Pelsman, if you can, I'd like you to call me. Then you can get offline and I'll walk you through this. Let me give you my cell number. Okay, my cell number is 303-817-8263. And then I'll get off and we can walk through this and hopefully get you on.
Sounds good. Appreciate you, Duke. And then Dr. Bird, so, you were the tee-off at the meeting in San Diego, and you are the most modest physician I've ever met. And when you look at human health and you reach up and hug somebody, Dr. Bird's like hugging a piece of iron. I mean, this is a man that very much takes care of himself, very much walks the talk, lives the life. And when I speak with him, and anybody that speaks with him, they're like, this is the most gracious individual I've ever met. And I second that and third it for sure. So, Dr. Bird, if you can, kind of, bring your Addison and your experience.
Yeah. Well, listen, Bill, I just feel like the luckiest man on earth. I feel like through the years, I've always tried to identify things that could naturally support the health of my body. Even though I was formally trained as an allopathic physician, meaning an MD training route, from my earliest experiences in the science-based part of my training, I was wondering, I remember being in a lecture in my second year of medical school, and they were talking about what stimulates a cell to become a cancer cell. And they were talking about promoter sites and suppressor sites on the gene that actually either turns it on or turns it off. And, you get these hits to these sites that cause mutation and basically inactivation of the site. If it's a promoter site that inactivates it, that's fine. But if it's a suppressor site that's supposed to suppress the gene, and you get both of those suppressor sites targeted by whatever this was, then the cell was free to begin its replication process out of control and not suppressed. And I remember raising my hand to this lecturer, and I said, so what's targeting these suppressor sites and causing this damage? He was clueless. He says, we don't know. But something's happening that leads to this process. And intuitively in my mind, I knew there had to be something outside of what we in the scientific community, at least traditional science, has been able to identify. So that opened my mind to more natural approaches. And boy, I'll tell you what, I probably spend $1,000 a month on supplements, just bolstering every aspect of the cell function that I can. And, I also am lucky enough to have a wife that is equally as interested in this as I am. And so she's looking stuff up, and everybody says she's the witch doctor in the family, and I'm the formally trained physician. But we absolutely love this notion of trying to live a vibrant, fulfilled life. And, I've never met a group of people more committed to that than this group of people I've met with Nulife Ventures. And that goes from the very top all the way down. Some of the most genuine human beings and professional human beings I've ever worked with, and that includes my medical profession. Sometimes in medicine, we know how to write a prescription. We know how to cut things out. That's what we've been trained to do. but we often don't walk the walk of living a healthy life ourselves. And so for many of our patients, they don't get a great role model on how to do this. And so I guess my first experience with this notion of Avicen therapy was about a little over a year ago when Bill Resides and I in Chattanooga met Tom and Danielle. And what a beautiful couple. From the very moment that I met them, I knew that they were just absolutely on fire with passion for this concept. And of course, I didn't understand all the science behind it. And Tom started sharing his information about the patents and the research ideas that he started developing and has completed. And I realized this is a big deal. This is much, much bigger than just helping with an ache or pain. When we talk about restoring blood flow to every cell of the body, we're talking about restoration of cellular function. We're talking about preventing atretic cell death and all the things that happen with the aging process. And it really kind of awakened in me a desire to get this thing out to the world and to make people aware of it and really have the impact it can. So from that experience, I almost immediately felt, this change in my exercise recovery. I was using it very quickly after I would work out, and often I'd be stuck with lactic acid buildup because I push myself kind of hard when I do work out, and soreness and all the things that come with that. And so that was probably the first thing that I picked up in my use of the Avicen. And then overall, just better sleep, more clarity of thought. And I believe it's just making all the other things that I was once doing work that much better. And now, after talking with Richard and exploring some of these notions of growth factors and the impact that it has on regeneration to the cells of the body, I see now that we are on the cusp of really understanding the full magnitude of what this Avicen is capable of doing. And with some research properly placed, I think we're going to have a lot of good tools for our representatives to present these ideas to clinicians and really understand how powerful this truly is.
Sounds good. And Dr. Bird, since you brought this up, I have to say, the meeting in Minnesota, a good portion of an hour and a half was going over the compendium of clinical science on thermal therapy. So this is including, the broad spectrum of sauna and infrared sauna and different therapies, laser therapies that are in sauna, and then just, basic heating the body or getting a warm blood into the body in a circulatory fashion. And I had several slides that I was just amazed at because we're directly involved with that with a FDA cleared device for very specific improvements in the body, pain primarily, but the other clinical studies that are being done. So it was so reinforcing of what we're doing. And then just one slide, to give you an example, was a slide regarding thermal introduction to the body that could increase the body temperature by a half a degree. All right, so the Avicen obviously has a mechanism that is much warmer than just a half a degree, 109 degrees to be specific. And those studies regarding detoxification of the body in heavy metals, cadmium, lead, these major things for children issues that they have, autism, all that, improving as much as 40 times the ability of the body to excrete that, and then excreting it through, different mechanisms. It was just like, wow. here we have this device and the thermal therapies for everybody, most of them are referred to as pods, and they're really great units. They're large, they fit into a clinic. Rarely would you have one in your home. They're expensive, and they cause a slight increase in body temperature. And the minimum unit is $20,000, and here we have this Avicen that can fit in a suitcase and sits at home, and you can use without driving somewhere twice a day as much as you want to. And we have that in our grasp. So I'd share that with you.
Hey, Bill, just a quick one. Michael, Dr. Pelsman has called in. So
Great.
He's on his phone, and I don't know who's controlling the call, but
Ali is calling.
Okay, so Ali, there's two. Ali, there's in the attendees list, there's a 516 number. It's 516, and it ends in 3131. That's Dr. Pelsman. And if there's any way you can allow him to talk, that would be great.
We'll see if that works. And Duke, I appreciate you eliminating the phone number so everybody doesn't get his phone.
Well, sorry, that's the only way I could describe his telephone or get him on this call.
All good. All good. So we'll see if he gets on board. And then I don't know if Dr. Contaratos is on the call. Maybe we could unmute him. Are you there? And if not, I want to go back to Stan Kanota. So Stan, if you're unmuted.
Excuse me.
Yeah. So Stan, I mean, what I wanted to, and I appreciate your brevity in the initial introduction, but your work in community medicine, you see in my commercial on community medicine for everybody is most people go to medicine and community medicine goes to the people, which is why I admire Stan so much, because that's a very difficult place to be in society, especially with the credential that Dr. Kanota has. And then it's a huge frustration because you're also deriving your funding not from insurance companies, not from banks or payer sources, but you're deriving it in different fashions. So in your experience with working with your community, and especially in Los Angeles, I mean, what did you see as a frustration out there with human health, and maybe tie that to evidence?
Yes, thank you for the question, Bill. Because usually what happened is when you are in an environment where people have low income, so the challenges that they face is enormous. And in my experience, been to the best institutions in the country, and also had a fortune of being able to train in a very busy place like USC. It's called Los Angeles County Hospital. So at such a place, you see so much pathology. You're exposed to a range of diseases that some clinician may have never seen their whole lives. So I was able to see so much and experience a lot of training regarding to different issues. But most of all, in what people, the key thing is to try to understand their background and try to help them in every kind of way that's possible. So the challenges that we face at some time would be you write a prescription, the patient can't afford the medication. So that would be one challenge. And then the other challenge would be you explain to the patient, to improve your health, you need to do these certain things. But because of the limitation, could be income or whatever, they don't really understand. Someone came on? Oh, did Dr. Michael came in?
Yes, I did.
There we go. Well,
Finally,
ladies and gentlemen, Dr. Michael Pelsman and Michael. So
I'm
to have you
completely
on the call.
challenged. I'm very sorry that
No.
I caused all this problem. I really am.
You're a fighter.
Listen, I have been a fighter all my life. It's the way I was raised as a child, as a young adult. And as you know, Bill and Joey and the rest of the people who know me, I'm a never say die individual. So I'll give you an encapsulated version of how I was introduced to this.
Thank you.
Okay. So as you pointed out, because I've been listening and I've been on, I just haven't been unmuted, which I finally am now. I was an athlete. I was very actively engaged in life. I embraced life every morning with positive affirmations.
And we rode on the same roads in Florida. Don't forget to say that.
Right. Yes, we have ridden on the same roads in Florida. Anyway, I had to fight for everything I've done all my life. And so I did my doctorate at Oxford. I came back to the States. I was trained analytically, and then I got involved in behavioral and cognitive interventions in my office. I really am a trained clinician, but I also do a lot of forensic work. And I have a big specialty in not just pain management, but in hypnosis. And I also do something called audiovisual entrainment and cranial electronic stimulation. And for those of you that want to find out more about that, I can send you to a website and you can find out how this coincides with people who are doing what I'm doing. So I work with a very diversified population of individuals, and I use a multimodality of interventions. And back in 2015, as Bill pointed out, I was riding on one of our common roads down in Florida and thought I was experiencing a heart attack. I became very short of breath, and I was only going up maybe a 30-degree in grade that was a drawbridge. And I got to the top, and I questioned whether or not I should get off the bicycle because I clip in. And I said, you know what, it's all downhill, so let me just go down and see if I can get my breath. Bottom line was, I was so flustered by the time I got to the end of the ramp that I failed to unclip, fell off my back. I displaced my middle finger on my right hand. It was at a 90-degree angle. This was on New Year's Eve, and I know I'm making this a long-winded story, but it's relevant. I ran to the emergency room. The emergency room physician could not straighten it. We called somebody about 50 miles away south of where I am in Florida, and fortunately, he was a specialist in terms of hand surgery. He was a hand orthopedic surgeon. He used some kind of a combination, told me to close my eyes and pray, which I did, and we avoided surgery. But what we never found out, because I would have been admitted for surgery that night, was that I was developing leukemia. And I was probably 190 pounds of solid muscle. Worked out all my life, did 110-mile bike rides and all sorts of things, ran the New York City Marathon, came back to New York, saw an oncologist, hematologist. He confirmed that I had AML, said we have to start right away in terms of treatment. I went into outpatient. I knew at that time, because of my positive thought process, that I was going to beat this, but unfortunately, my mutations were such that it required, if I was going to really win the battle, I needed a bone marrow transplant. And so I researched, went all over the country, interviewed a lot of physicians. I wound up at New York Presbyterian and had a very successful bone marrow transplant. Unfortunately, my immune system was compromised. And about 6 months post the bone marrow transplant, I was sitting in my office. I started seeing double vision with a patient. I called up a friend of mine who's an ophthalmologist. He said, Michael, get back into the city. I saw a neurologist, and she said I had the rarest variant of Guillain-Barré syndrome. So here in 2 years, I was smacked down twice, and there was a sense of disbelief on my part. But again, I said, okay, well, what do we have to do to get rid of this? And they tried all the traditional interventions, IVG, plasmapheresis, and everything else. Unfortunately, because of my variant, I wound up, as you pointed out at the beginning of the meeting, I wound up a quadriplegic. I could not even move a muscle in my body. I was unable to talk. They had to sew my eyelids closed to prevent my corneas from being damaged. And for 8 months, I had to live in my head, and I used every psychological mechanism that I knew of to maintain my fortitude and positive thought process. I was able to hear, but I was not able to do anything else. Fortunately, there was a very young physician on staff who applied for a grant to use a drug called eculizumab, which had never been used before in the application for GBS. And I was able to get the grant. It was a once a week for a month treatment. I started to move, but when I left the hospital, I had 5 different physicians from 5 different specialties tell my wife and myself that I'd probably wind up in a motorized wheelchair for the rest of my life, which was completely unacceptable. Now, the problem that I encountered when I was at the hospital, and this is important because this is where the Avacen comes in, is that in spite of my wife's protestations and a good friend of mine who's an orthopedic surgeon, they never sent any OT or PT to me for the first 3 months. So my entire body, other than wasting away, contracted. My hands and my feet were completely contracted, and they thought that that's the way I was going to remain. You can see right now that that's no longer the case. The only problem was that the contractions in my feet were such that even speaking to a number of surgeons at the hospital for special surgery in the city, they said that the surgery to correct my feet could result in a drop foot, which would be worse than what I have right now. And I fortunately was able to receive very effective PT and OT when I got home, and progressed to an outpatient clinic. And through my own determination, have been able to stretch the heel cords in my legs and the gastrocs so that the heel I was on a platform heel because I was walking on my toes because I can't dorsiflex my foot. And so even though they said it would never happen, it's taken a while, but the heel cord is beginning to stretch down. The platform is much lower right now. And as you pointed out before, Bill, I am walking with canes. Now, here's where Avacen comes in. I'm not sure how many of you are familiar with Guillain-Barré. It's a very, very devastating neuromuscular disease, probably similar to MS and muscular dystrophy in a lot of different ways. They're not really sure what causes it other than a virus. You can get it from something as simple as a flu shot. And so Michael Ladd, who has been a friend of mine for over 30 years, and he called me up about 6 months ago. And during the time of my recovery and rehabilitation, every morning I would wake up and from my elbows down through my fingers, I felt I was in a vice grip. The muscular tension and the neurological pain was on a scale of 1 to 10, I would say probably between an 8 and a 9. It would take me hours to be able to relax those muscles, and using of course, outside medications and everything else for the pain, which I didn't really want to do. I'm very much a naturopath and an integrative thought process person. Allopathic medicine has its place, but I believe homeopathic medicine has its place. And as Joey said, I was a nutraceutical taker for years and still do. And so Michael called me up and he said, Michael, I have been introduced to a class 2 medical device, FDA approved. He explained the process. He said, why don't you give it a try for a month? And I'm a very open-minded individual. I said, I'll try anything to progress and rehabilitate myself even further. And after about a week's usage, I found myself waking up in the morning, and the period of time that I was immobilized in my hands and my arms started to shorten. And by the end of the month, I can tell you that my pain level now, when I wake up, is a very modest 2. I'm not even aware of it any longer. The only thing I can ascribe this reduction of pain and my rehabilitation to is the Avicin, because there isn't anything other than that I have used as an intervention. I can tell you as an aside, my wife as well uses the machine. She's an athlete, and she has a little bit of arthritis in one of her hips, which has been very manageable at this point in time. But when we went down to Florida to visit our home on one trip, we forgot to take the Avicin with us. And after 2 days, just 2 days of not allowing ourselves to be treated, there was a noticeable change in our pain level and discomfort. And we couldn't wait to get home. We thought about sending it down, but we thought maybe we'd cross in between our trip. And I can tell you right now that I've used it with some of my patients. I have a patient of mine who unfortunately has had both Hodgkin's and non-Hodgkin's lymphoma. And he's had a bone marrow transplant as well. And unfortunately, he's been left with neuropathy in his legs. And he just unfortunately was re-diagnosed. He had a resurgence of his non-Hodgkin's lymphoma and had to have some immunotherapy, and started experiencing a lot of pain in his legs again. And I let him try the Avicin in my office. And in one treatment, he said that he was able to receive relief, and asked me how he could purchase the machine. And he's been using it twice a day, sometimes more, and told me that his neuropathy is hardly noticeable anymore. And his, of course, attitude about life is now regenerated in terms of process. Let me bring up one other thing, and then I'm going to go because I'm too long-winded right now. I had a new patient introduced to me yesterday by a prior patient of mine. It was her mother. Her mother's been in terrible pain with her back, has seen specialists all over New Jersey and New York, and has basically been told she has 2 bulging discs in L4 and L5, and there's very, very little they can do. There are other psychological intervening variables that I realized exacerbated the level of pain, because every doctor said that the pain level she was expressing was really not in concert with what the defect was. She went to see another spine surgeon the other day who said it's not bulging. She has herniated discs. She does need surgery. But besides doing psychotherapy that lessened her pain because it was exacerbated by her own emotional state, I allowed her to use the Avicin for 15 minutes. And the beatific look on her face when the session was over, and the lack of sharp pain that she was experiencing when she walked into my office now was gone. And her other child, the one child that introduced her to me is an OT, but her other child is a chiropractor in New Jersey. And he called me already and asked me how he can secure this machine because he wants to interface it into his chiropractic practice. So I know it's been a long-winded journey. I'm sorry for that. I'm sorry that you all had to put up with this, but I really wanted to make emphatic how much I believe in this product. When I brought Richard Carlton, Dr. Carlton, on board, and he explained to me more from a medical basis why the system actually works, it reinforced in my mind that the application of this device for a variety of usages in both the medical and allied medical health field is we're pioneers. We're at the beginning of something that I think is going to be larger than almost any other medical device that has been presented in the last 5 years. And I'm looking forward to being part of that and part of this group.
Thank you, Dr. Pelsman. Unbelievable and long-winded. No, your story is the wind beneath our wings. And that is exactly, as you noticed, I went off video for a moment. Your story is so emotional to me, and I hope others may have experienced that because of it's not the tiger fight, it's the fight in the tiger, and you have a huge one, and you have a...
Thank you.
Yeah, unbelievable. And you're one of the few people that can find a 30% grade in the flat state of Florida. So that's a unique quality that you have.
I appreciate that remark. I appreciate that remark.
Absolutely. So everyone, I want to complete the call in an hour. We've literally done that to the minute, and deeply appreciate the input from Dr. Carlson, Kanota, Dr. Bird. Always just a joy to hear your spirit, and Dr. Pelsman. And then we'll be doing this once a month. Certainly introducing other doctors on the board. We have some exciting things coming up with research opportunities. My hat's off to really, Tom and what he's done with Addison and his pioneering with science and credibility. The patents, I want everybody to know that the patents are, from a legal point of view, the most powerful patents I've ever seen. They're actually in the operation of the unit, not just the existence of it. So those are details all of us will know as we bring Tom on board to talk about some of those things. And I just want everybody to know, as I close the meeting in the launch meeting, the most important thing that we have is credibility. And credibility is based on evidence. And evidence is based on credentials. And credentials are based on the experience of the individuals. And let me tell you that when you have 320 years of experience clinically with a small group of people, that's a huge amount. And the most important thing that all of us embrace, and this is the largest collection of people we've had on a call on a Saturday, I believe in history. And the evidence and the credibility is your ability to share something that you can't screw up. You only get one opportunity to do that, and that's to share this with a friend. And that's what Dr. Pelsman did with Dr. Carlton. So if he can do it, I guarantee you every one of us can do it. Have a great Saturday. Really appreciate you all joining the call. And with that, I'll close everything out.